talking about febrile convulsions. We all have children or nieces, nephews, or even people under our care, young children, and it's important to know what exactly to do when we have, because seizures can be quite alarming and disturbing.
Okay, so the first patient is Miss CEA. She's a 12-month-old female who presented to the ER convulsing. So earlier that day, she presented to the outpatient department with a day history of high-grade fever, non-backing, and non-paroxysmal cough. So temperature at presentation was 38.3 degrees Celsius, and she was given suppository PCM.
That all seizures are convulsions, and that is false. Convulsion is just the motor manifestation of a seizure. Seizures are paroxysmal clinical events that occur on account of an abnormal discharge going on from the cortical neurons, and the manifestation can be in different forms, one of which is motor. Another can be autonomic, and that is why in newborns they can have repeated desaturations, recurrent apneic episodes, which may be a form of seizure. So when an individual or a child has the motor manifestation, jerking of the limbs, abnormal stiffening of the muscle, that's when it's called convulsion. Absence seizures, for example, the child is seated in the class, has that brief period of impaired consciousness for a few seconds, with repeated blinking. He or she doesn't have any motor manifestation. The teacher may not even take note, but that child has had a seizure. So it is a seizure, but it's not a convulsion. The second is that having a seizure means having epilepsy, and that is not true. Seizures, like the topic we're discussing today, febrile seizures, febrile convulsions, one would not tag such a child as having epilepsy. Epilepsy is when an individual has 2 or more episodes of afebrile or unprovoked seizures in more than a 24-hour period. So if an individual, in this context, a child has a seizure, it doesn't mean that the child has epilepsy. And even an individual, because an individual or an older person who had a road traffic accident, had a head injury, and then had a seizure within the acute phase, one would not call that epilepsy. Seizures can be stopped by putting a hand in the patient's mouth. It's not only false, it is dangerous. We would learn in the course of the lecture what to do when we encounter a person having seizures.